there are some basics you need to know before you enroll in Medicare. Let's start with the ABCs. Part A is your hospital insurance, and that covers things like hospital stays or stays at a skilled nursing facility. Part B is your doctor coverage. This covers things like emergency care, doctor visits, even covers things like your flu shots. It's important to know that Medicare A and B, original Medicare, have other costs associated with them.
We know that most seniors are really concerned about what those costs are going to be, both in the short and long term. And it starts with working with a Medicare agent or broker that you really trust and who really understands your specific situation, because there's no one-size-fits-all budgeting tool when you're in retirement. Even something like your Part B premiums are ultimately going to depend on what your income level is, in addition to the various out-of-pocket costs that change by plans and your specific conditions. So understanding what those expected costs are the first step, and that comes with working with your trusted Medicare agent. And then on the second half of it, that's where you really want to work with a financial advisor that you trust in retirement, because they can help you budget and bucket your assets and income in order to withstand any unexpected payments that you have that weren't originally included in your out-of-pocket projections.
Annual enrollment is that one time each year where beneficiaries can make a change. The annual enrollment period runs October 15th through December 7th. The first step in annual enrollment is really to review your annual notice of change, or ANOC, as it's sometimes called. This is a document that your insurance company sends to you to review how your benefits, your costs, and your coverage are changing from the prior year. You should review your premiums, copays, and benefits to ensure you're getting the best plan for your health care and your budget. It's also important to review your plan's network. Look at the pharmacies and doctors that you visit and make sure they're continuing to be in the network of your plan. There are a number of tools online to help you compare plans, including eHealth. We compare plans side by side, and you can be ensured that you'll receive unbiased advice. Our advisors get paid the same no matter what plan you choose, and we're always a free service to you.
We all know that your health changes as you age. That's not a surprise to anyone. And with that comes changes in healthcare costs, but also your lifestyle. And your lifestyle and your healthcare costs are going to impact what that financial plan looks like. So oftentimes what we see is, the catalyst for big decisions in retirement ultimately come down to changing health. And whether that's moving into a new condo that's more accessible, or being closer to loved ones that who are helping care for you, those are all intertwined when you're in retirement. And that's why it's important to have a financial advisor that you trust and a Medicare agent that you trust, because you can think of them as your team, coordinating how to cover your healthcare and lifestyle needs in retirement. And when we think about being young and healthy at the early years of retirement, that's a different spending than, as you age, you might slow down a bit and not be traveling as much, right? So working with a financial advisor who understands how life changes in retirement is really important.
Medicare can be extremely overwhelming and complicated. To avoid a lot of grief, a lot of confusion, an agent can help guide you through the multiple plan options available to you and different types of coverage. Licensed agents can help you decipher your plan options. They can help you learn what the difference between Medicare Advantage, a standalone Part D, and Medicare Supplement is. They can also show you plans available to you in your county from multiple carriers. They'll help you compare your costs, your coverage. They'll help you look at the network to make sure your drugs and doctors are included. It's important to note that when you're working with a licensed insurance agent, they are never going to ask you to pay extra costs. Their fees are free of service. They are paid a commission by the insurance company for the plan they sell. So there'll never be a charge to you to use their services.
what we often find is people fall prey to the fear tactics that a lot of salesmen use to sell precious metals like gold and silver. And you don't actually own that precious metal, but you'll make a purchase and then you won't be able to get your money out. So make sure that you understand how those transactions work. Cryptocurrencies have really been used as get rich quick schemes, and we've seen a lot of headlines about people who have gotten rich, and those predatory agents out there are using those headlines to take advantage of people and convince them that they're going to make a ton of money on what is a very complex financial product. And finally, annuities. There's a lot of great annuities out there. There's a lot of ways to incorporate that in your financial plan for security in the long term, but they also carry big commissions, and you'll see people selling those annuities that ultimately are not in the client's best interest and are very complex. So we see a lot of clients who don't really understand the mechanics of those or what they're ultimately going to get out of them. So make sure that you work with a fiduciary financial advisor and have them evaluate any of these offers that you see to make sure it's legitimate and in your best interest.